Hey guys, this is Dr. Hub. Today we'll look at the methylene blue 3 swab test. So here a catheter is introduced. So it is about a catheter which is being introduced into the bladder through the urethra. So it is introduced to the bladder via urethra. And the vaginal cavity is packed with 3 sterile cotton swabs. So the vaginal cavity, it is packed with 3 sterile. So there are 3 sterile cotton swab. One at the vault, one in the middle, and one above the interosseous. So one in the vault, one in the middle, and the third one is in the above the interosseous. Above interosseous. So now what we do is there is a diluted solution of methylene blue. So there is a dilute solution of methylene blue. So this dye is injected. This dye is injected into the bladder. So it is injected into the bladder using a transurethral catheter. There is a transurethral catheter which is used. So after 15 to 20 minutes, after 15 to 30 minutes, the swabs are removed serially and inspected for dye. So they are removed. So after 15 to 30 minutes, they are removed and checked serially for the presence of dye. How is it checked? It is checked serially. So now let's look at the interpreting them. So under the interpretation, the upper swabs get wet and not stained. The upper swabs, in terms of upper swabs, they get wet. It gets wet and not stained, but not stained. So they get wet but not stained. The leak is from the ureter. So here the leak is from the ureter. Ureter, that is the ureterovaginal fistula. Ureterovaginal fistula. Next is in terms of the upper swab. So the upper swab, it gets stained. The upper swab gets stained means the leak is from the bladder. So the leak is from the bladder. So if the leak is from the bladder, it is nothing but the vesicovaginal fistula. Next, we look at the lower swabs get stained. So in terms the lower swab gets stained, here the leak is from the urethra. So the leak is from the urethra. Indicating the ureterovaginal fistula.